Now, health authorities in the Ayawaso West municipality have launched an urgent investigation into the escalating cases of upper respiratory tract infection, which persist as the predominant health concern for the third consecutive year. Now, the agency is compounded by a simultaneous rise in hypertension cases, propelling health officials to swiftly uncover the root cause behind these concerns. Now, my colleague Michael Ashale has more in the following report.
In the Ayawaso West municipality, a concerning health trend has taken center stage as upper respiratory tract infections continue to surge, claiming the top spot among the 15 leading causes of morbidity for the third consecutive year. In 2023 alone, the municipality recorded a staggering 25,700 cases of URTI, almost doubling the figures from 2021 when 13,300 cases were reported. At an annual review meeting, it emerged that there were more than 172,000 illnesses reported at the various health facilities in the municipality. Principal Health Officer Rosemond Asase gave the breakdown.
It's seen here once again that upper respiratory tract infection is topping in the years that we have been in existence.
Exposure to air pollutants such as fine particulate matter, nitrogen dioxide, and ozone has been linked to respiratory illnesses, including URTIs. These pollutants can irritate the respiratory tract, making individuals more susceptible to infections. Additionally, air pollution may weaken the immune system's ability to fight off infections, making individuals more vulnerable to respiratory illnesses.
Other important issues emerging include climate change and issues relating to air pollution. The effects of these, we know, can be devastating to health.
In her address, Dr. Louisa Ademki Mate, the Municipal Health Director, underscored the significance of deteriorating climate conditions and their potential impact on the prevalence of respiratory infections.
We know also the relationship between air pollution and non-communicable diseases such as chronic respiratory diseases like asthma and chronic obstructive pulmonary disease and even the cancers.
In recent times, Accra attained the unenviable top spot as the city with the most polluted air. The EPA and the Ghana Health Service both issued separate statements on the impact of the pollution on health. Nonetheless, Dr. Mate, while addressing the issue, refrained from immediately establishing a direct correlation between air pollution and the rising instances of upper respiratory tract infections. She spoke on the sidelines of the event.
As a district, we would this year look into these conditions that we have classified as upper respiratory tract infections, liaise with the facilities and look at how we can segregate the data, take more history from people who come reporting with upper respiratory tract conditions and see how many of them we can relate to other things other than infections.
The area surrounded by busy roads like Tetekwashi Roundabout deals with continuous air pollution from vehicle fumes. Clean Air Fund's census highlights the issue. Desmond Appiah, Clean Air Fund's country director, stressed on the need for investigations and specific policies in the municipality to address the growing health concerns.
Part of the projects that we are running is also putting local census to augment what EPA has, and it gives a good sense of where we need to realize that pollution may be high, and then identify the things that are happening around those areas that may be leading to that pollution, just so you can be able to target your actions. This is where they say the rubber hits the road. In the districts is where the real action happens.
With a total of 32 health facilities, majority being privately owned, the Ayawaso West municipality is yet to welcome a new government-managed health facility. Municipal Chief Executive Sandra Ahinkra confirms the upcoming addition to enhance healthcare services in the area.
I am therefore happy to inform this forum that our municipality is benefiting from the government Agenda 111 program. This will involve the construction of a 100-bed district hospital at Roman Ridge, having finally overcome the major obstacle of land. The consultants have been instructed to commence work.
Like the adage goes, an apple a day keeps the doctor away. Translating it in relative terms, wearing a nose mask daily acts as a protective shield, keeping health concerns at bay. This story was a collaboration with New Narratives. Funding was provided by a Clean Air Fund. The funder had no say in the content of the story. For Joy News, Michael Ashale.